Every 3 years, Houston Healthcare does a community needs assessment. And this is a very thorough assessment. We bring in community leaders to share their opinions about the health of our community. We also bring in our community people and ask them their interest or their concerns about health in Houston County, and then we collect a lot of data. We take all that information and we review it, and we set what are our priority areas for Houston County. What do we need to address to improve the health of the people in Houston County? Right now we have 4 priority areas. Then the first one is wellness, where we do address the major risk factors for illness. The second one is access to care. We want to be sure people know how to access services, and it's easy for them to access those services. The third one is chronic disease. Once somebody has a chronic disease is a disease that can be controlled or managed, but it can't be cured. So our third area is chronic disease, and the fourth area is vulnerable populations. We've identified our elderly and also our pregnant women and newborns as part of that vulnerable population. And once we've got those priorities, then we take or we develop special classes to go under each area. For example, for the first one, for wellness or wellness promotion or prevention of illness, we have our healthy living class that meets once a week. They have different topics, they have different speakers, and they cover all aspects of what makes a healthy life. They have the option of weighing in if they want to and tracking their weight loss and tracking their improvements in health. That's one example of we have. We also go out to the different work sites or industries, and we do health screenings for them. From those screenings we see what's abnormal, who has a risk factor, and then we help these people to develop goals or wellness goals so they can improve their health. For access to care, we actually have a person who does referral services for us. You can call, maybe you're new to the area, you need a physician. You can call and say, I'd like a physician who is in Warner Robins or who is in Perry, and she will help link you to that physician. The same person, if you don't have insurance, she will work with you to give you resources for linking into someone who can provide health services for you. We also, for access to care, we look for grants and funding. For example, we have a grant that will fund mammograms for women who do not have insurance and lower income. For chronic disease, we look at the 4 major ones that we see in Houston County, which would be heart disease, hypertension, diabetes, and COPD, which is chronic obstructive pulmonary disease or respiratory difficulties. And we've developed management programs for all of these that teach the skills to manage or control these illnesses. The fourth one is our vulnerable population, and for that we do more individualized care or specialized care. For our high-risk pregnancy ladies, we have a nurse care manager who works directly with them to look at what is causing their high risk in their pregnancy. Is it diabetes? Is it high blood pressure? She teaches them how to monitor this. We teach diet, if a diet is related to that, to assist them to have a healthier pregnancy. For our elderly, we have specific programs. We know one in 3 elderly people will have a fall or accidental fall each year. So we have developed Matter of Balance program, which is an evidence-based program to prevent falls among our elderly. We also teach Tai Chi, which helps to improve the balance and the strength of our community elderly people. The community can benefit from these services by looking at what classes pertain to them or what are they most interested in. You know, health is a continuum. There's none of us who cannot improve their health. Even if you're in good health, you can always work to improve your health. So we encourage all of our community people to look at the classes and the offerings that we have and to select what they would like to attend. We have people from all walks of life we have children, classes for children all the way up to older adults. Our marketing department puts out a publication called House Calls. And in House Calls, it has a listing of all of the different classes. This comes out quarterly. It's mailed to some homes. It's also on our website, or you can call our office, which is 923-9771, if you want more information on a class that you've heard about or read about. And you can also register at that same time. The Community Education Department does enhance the overall patient experience because we're the continuum of care. Patients come, they are hospitalized, hopefully no more than a few days, and that starts the healing process. But Educare, or community education, takes that further in that we have more time to spend, we can provide the education, we can teach skills to manage, so hopefully they are not readmitted to the hospital or hospitalized once again. We have seen dramatic changes in our elderly who maybe were not doing anything. We have developed programs specifically just to target these people who maybe have not been exercising due to illness or accidents. We have a program called Walk with Ease, and that's exactly what it is developed for. It's for people to start, and they start by just walking. We also provide free exercise programs for our older adults in Perry as well as in Centerville. And these are developed for our older adults to start exercising. And they are for any age. We say we don't check IDs at the door. Anybody can come to these classes, and they are developed for people who, they don't want to go to a gym. They want to start out slowly with their exercise. We also provide Tai Chi. And most people can do Tai Chi. It's slow, it's stretching, and it definitely improves the balance and improves the muscle strength. So there's always something that you can do to improve your health, no matter your age and no matter what condition you're in.